Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the topics for today's show: education and health care, an update on cyber charter schools, and health care reform. Two big topics, all of that following these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program as always. Okay, shameless self-promotion. I want to thank our viewers around the state and WGAL, #1 in our time spot. More viewers than Face the Nation, more viewers than, who's that other show that deals with news on Fox? I won't get into that. And more viewers than George Stephanopoulos' program. It's all about you, and it's all about great guests like the guy sitting across from me, Dr. Nick Trombetta, who's the CEO of the Pennsylvania Cyber Charter Schools. Welcome back.
Glad to be back.
All right, no shameless self-promotion. We'll let somebody else get into that.
No, I'll get right on that bandwagon. We'll join up and promote ourselves right
there. You go. All right, look, tell our viewers, cyber charter schools, what are they?
Cyber charter schools are public schools that provide a significant portion of their instruction via computers and the internet.
Okay. And you've been, and your school itself has been in existence for how long?
Pennsylvania Cyber Charter School.
Right.
We started in 2000 with the hopes of educating 50 students.
50.
This year we are going into our 10th year, and we anticipate over 9,000 students.
9,000 students. Yeah. Now, when you first started to come on and we talked about this over a long period of time, we have seen sort of phenomenal growth.
Yeah.
In online, best way to put it, online education, a proliferation. I mean, I can't, every school district, it seems, is doing it. Colleges and universities are doing it. Talk a little bit about that.
Yeah, it's really, I think proliferation is a great word for it to describe what's happened. When we got in 2000, roughly 600 to 700 students were online. It's easy to say that just through cyber charter schools, and I have, there are 10 other schools besides PA Cyber, just within ours, we'll probably be reaching over 25 to 27,000 students alone.
Wow.
Just there.
Wow.
But what you have also is that the traditional public schools and private and parochial schools now have picked up, so that you basically have, among public schools, 500 different cyber programs available to them.
Yeah.
So now students anywhere, anytime can access what only a few students did before.
Sure.
So it is a proliferation.
And you were aware of this. We chatted about this over the years. I mean, you certainly knew this was going to happen.
Yeah, we predicted it early, and now a lot of folks are saying that by 2015 that you'll see 50% of your high school courses offered online.
Wow, wow. All right, well, let's turn to another topic, and that is how people, not broaden it, how tuitions are paid for those cyber charter schools, and there is a debate going on right now as we speak, am I correct, about the most effective and efficient way to handle tuition rates. Why is that a big issue at the moment?
Well, I mean, it's a big issue because who's going to pay for it? And right now,
it's always a big issue.
It's always a big issue, and money's always a topic about when it comes around to education. Charter schools. There are brick-and-mortar charter schools that provide some services in a location where students come to. And then there are cyber charter schools that provide it from a location to students generally in their home. Generally how that's funded is there's a formula based on where that student lives, and a charter school or cyber charter school will receive anywhere between 70% and 80% of what's spent on that child on where in the district in which he lives.
So do they get the money from the state itself or from the school district, so our viewers know this?
Right. Well, the school district will get dollars from local and state sources, but the district is built and the dollars follow the student to the school.
Okay, so I get your point. So some of it would come from the state to the school district, and then the school district to the school.
Yeah, the district is billed.
Okay, the district is billed. Now, what is the proposal that is now being debated that deals with, I guess, what we could call as a plan, a fee, a rate that would be set for all schools? Talk about that.
Yeah. One of the frustrating things for everyone has been the fact, and for many different reasons, the fact that you have such a disparity of what's spent on a student, where wealthy districts may spend $15,000, $16,000, $17,000, and the poorer districts may spend $5,000 or $6,000. When you're dealing with, we educate kids in probably of 500 school districts, 495. So that means there could be 495 different rates.
Wow.
So some pay at a low rate, some pay at a higher rate.
I got it.
So there have been ideas of trying to get to a single rate.
Okay.
And that's what's been...
All right, hold that thought, because I want to talk about the pros and the cons of that with you in a minute. But that's sort of consistent with the big debate that's going on in this state forever about the state, about the formula or the lack thereof that is used to decide what each school gets, each school district gets, and that varies. The state share of that varies, right?
That's
so
correct.
It's not inconsistent with that debate.
It's inconsistent with the results of what they want to accomplish.
You got it. All right, back in a moment. We're talking about education. That's a topic. Healthcare will come up later in the program after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program. Dr. Nick Trombetta is here. We're talking about cyber charter schools. We got into a little bit about their expansion over the years. And let's focus now on, you've got a proposal. Is it for a uniform tuition rate or cap? What's the best way to think about that?
Well, the term that the proponents use is rate.
Rate,
but it actually is a cap.
Is a cap.
And what basically it is a number that they believe it would, the true cost to educate a student in a cyber charter program. And it's around $9,000. The problem we see is it really is a cap, because 350 school districts about pay less than that number now. And so what the idea is that those that pay less wouldn't pay what it costs, but those that pay more would come down to the cost.
I get it.
So those that would be held harmless, that we've chosen, there's an amount of around $9,000 that the state has set, they wouldn't pay that what it costs, and those that pay more would get a break.
So, I mean, it is not a different situation from the funding for regular schools, where the state share of it is higher in some school districts and lower in some, and it may not be related directly to the actual cost, which then has to get made up in property. Is there some, or am I going somewhere I shouldn't go?
I think, no, that's all part of the topic, because then you really, the bigger issue is what the administration has talked about for several years now, and that is equity.
Equity, right.
But we would like that conversation to continue to include all public schools, cyber charter and charter.
I got it. Let's bring this down now to the school district level, where this is where, these kids are in a school district, they sign up for your program, the state gives a certain amount of money, that money would go to the school districts, and then the school districts would provide it in tuition to your institution, correct?
Correct.
Now, would they make up the difference if it's, or is that would be the total that you would get?
Just one other step in that is that any student goes to any charter school, the majority of the districts receive about a 30% reimbursement on top of what they've sent. Remember, we mentioned earlier, they're sending 70–80% of that number. They would receive now a 30% more return, or a rebate, basically, from the state.
To bring this full circle, then, what does this mean to the parents of the students in your schools?
Well, what this does is that it would jeopardize definitely the programs that we provide. We employ thousands of people now. Their employment would be threatened. So in these times, we don't necessarily need that. I think that you would see a decline. Pennsylvania is recognized as probably the best state in providing online instruction right now. We're probably the leader. recognized as leader by most others. That would probably put us back. We wouldn't be the leader anymore, and you probably would see a decline in services and a decline in what I've mentioned to you.
Before I let you go, where does this debate over the tuition rate or the tuition cap go? Where does it go? Where does it stand right now?
Where does it stand right now? Well, it's within the legislature. It's
in the legislature.
Sure. Yes.
And so the legislature has the option then of adopting this plan or not to adopt it.
Yeah, and we are hoping that they would include us in the discussion and reject this and find a fair way. And we would be part of that discussion.
And where do you think it's heading? Or is it something they're not doing right now because of the budget?
Well, we're not doing a lot of things because of the situation.
That's for sure,
of the budget.
because of the budget.
But, well, it's something that we're very vigilant about. Our parents are very active in protecting that.
Okay.
It's even worse on the special education side of what they plan to fund it. Possibly the services could be cut, which violates federal laws to those students. So we are very active in letting our voices be heard and representing our students and our families and our employees. And I think we're being heard. We have champions that have taken up our cause. And so although I'm hopeful and optimistic, we need to be vigilant.
Okay. Thanks for coming in, and thanks for the update. All right, health care reform, it's on everybody's mind. It's on our mind here, too. We'll be back with that.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the third and the fourth segments of the show. We're going to do a little state budget update, and as always, healthcare reform. Sitting right across from me is Dr. Stuart Shapiro. He's the president and CEO of the Pennsylvania Healthcare Association. And this guy has not been on for a while. He's back now, David Sweet. He's a partner with Buchanan Ingersoll and Rooney, I might add, a former state legislator, a former member of Governor Rendell's transition team. And you managed this campaign, and I think you either get a lot of credit or a lot of blame.
It hasn't changed. It's been that way since 2002.
That's true. Yeah. All right, David, look, no one probably knows more about this budget process than you, having spent so much time. It looks like the Republicans with a set of positions and the Democrats so far removed. Well, do you have any idea how this is all going to play out? $3.2 billion deficit, very far apart. We're almost a month into no budget. Where does this all go?
Right. It's going to be tough because both sides seem to have painted themselves into a corner, and it's going to be difficult for them to make the kinds of compromises that are necessary to pull this off. And particularly the size of that deficit is so different and so much larger than 1991 or even 1977 when there were big, long budget fights, that it's going to be a tough thing to do. And people are going to have to be creative in coming up with solutions that perhaps haven't been put forward yet.
That's a good point. Let me ask you about stopgaps. I mean, something that, as you know, when Governor Shapp was there, they did stopgaps. It didn't work. You know, lots of people upset about it. No governor after that, except Governor Rendell for the education budget in 2003, allowed stopgaps a possibility to move the process forward?
Well, they're talking about something akin to that. I personally think that would be a mistake, even though the current loggerhead situation causes a lot of trauma and real personal angst for state employees and for others relying on the state budget. If you let the pressure off of the pressure cooker, then people go on, and then you have rolling fiscal chaos for months and months and even years.
What aspects of the health care are caught up in this debate right now in Harrisburg?
Well, there's a real risk that if the right revenue and program balance doesn't take place, that the elderly could be losing access to care, and especially when they need it in nursing homes or hospitals.
And Medicaid. The
Medicaid budget is a big issue. Nursing homes today lose money on Medicaid, and we're now talking about national health reform, which would make
I want to come back to that in a
and
minute.
we'll come back to it,
Yeah.
but there's a real balance between Medicare and Medicaid. And the President has proposed, and the Congress is proposing, as part of national health insurance, cuts in Medicare. And if those take place, then there's even more pressure on the state, and the state's already feeling enormous pressure. So we're just hoping that the legislators and the governor come to a balance that doesn't leave the elderly left out and deny them access to places like nursing homes or home and community-based services.
David, look, you spent a lot, your days in the legislature, you know this state, a huge senior citizen population. It's, what, third oldest now, I think. Can you imagine a situation where the legislature of this state does not somehow take into account the needs of senior citizens? When you were in that, I mean, that's all you heard? Go ahead.
Right. Well, no, you're right. And senior citizens have been not only a huge part of the population, but if you look at it in political terms, they're the voters.
Yeah, that's exactly right.
Our healthcare system, and particularly the part of the system that provides services to seniors, is really fragile in a financial sense. This is not a place to go if you're trying to make big, huge profits.
Right.
And nursing homes and hospitals have really tough challenges ahead. And they're so reliant upon government payments that this is really a key battleground, and it's just got to be solved right, or those of us who are getting closer to the need for those services are going to be hurting.
We're going to take a quick break. I want to ask Dr. Shapiro when we come back about some of the aspects of the National Health Care Plan and their effects on seniors. There could be some big effects on Medicare in particular. We'll take that up after these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care. This broadcast of Pennsylvania Newsmakers is presented by Penn Future, where we believe that every environmental victory grows the economy, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania.
Hi, welcome back to the program. Healthcare reform is our topic du jour. I like that. Dr. Shapiro, let me ask you this question. Voters say, citizens say universal health care, they're in favor of it. Right. There's some pushback now about the programs being discussed in both the House and the Senate in Congress because of the cost. Over $1 trillion, and who's going to pay for it? That's a huge consideration. Is there any way out of that dilemma?
There's a balance between access, quality, and cost. And there's no question that whatever is done is going to be very expensive.
Yeah.
But the discussions are just beginning to gel. The House just this week had a bill with over 1,000 pages.
Correct.
But it's unrealistic. It says we're going to spend $1.5, $1.3 trillion.
Yeah.
It also says we're going to fund that 1.3 trillion with new surcharges on, quote, the wealthy. We're going to take cuts in Medicare, and we're going to save several billion dollars out of Medicare to help pay that over $1 trillion.
Yeah.
And then they say that if they don't have those cuts, the surcharges will go up.
Yeah.
Well, those cuts are silly because they're not realistic. You can't take billions of dollars out of Medicare without shifting those costs to the state or bankrupting hospitals and nursing homes.
That's a good point.
And
go ahead.
You can't do that.
Yeah,
it's not realistic.
The other concern is, and it's that if they're not careful, they could take, I mean, everybody knows that Medicare works. It's a little expensive and it needs reformed, and everybody agrees. But as a plan, one of the concerns is that in what they do, they could literally destroy Medicare and maybe create a situation where seniors end up with another kind of coverage in another public health care plan devised that could create a far more consequential system for seniors. Is that a concern that you have?
That is a concern, but there's also concern that this is smoke and mirrors. Because if they cut Medicare, they're going to shift those costs to the state. Right now, nursing homes or hospitals make up their losses on the losses that they have every day on Medicaid with Medicare. And you now take the Medicare payments out.
So you take that. Good point.
The costs are going to shift to the state. The states don't have money. And we're not talking, as David said earlier, an industry with a lot of profits. I mean, this is 1% and 2%, which doesn't even pay for the capital costs to continue to improve it.
Go ahead. David, I want to look. We had this discussion about energy. You know, and you spent some time in the legislature, and you follow this national scene. Should the states be sort of sitting back and not doing a lot of changes to their policies? I won't ask you about energy, but in healthcare until it's clear what the federal government is going to do. I mean, the states could end up like universal health care in Massachusetts and some other states that now have it. Should this be a kind of let's wait for at least a year or so and see what the federal government does? Or what's your sense about that?
There's some wisdom to that, to not get it too confusing. Although the state, you know, has always had the PACE program, the drug
that's a good program,
and had a very good program. And then when the federal government came in with the prescription drug program, they were able to mesh that and actually
that's true. Good
do
point.
it successfully. So it's not impossible to do. But you make a good point with all of the problems that are confronting state government today. It's important to proceed with health care reforms, but the Obama administration is throwing a lot of things at Congress, and Congress is going to act on health care reform one way or the other.
Yeah, that's right. Now, but the bigger point is let's take universal coverage, something you and I have talked about, right?
Right.
Should the state at least wait before trying to cover most of the 800,000 people in our state who doesn't have it, because we could get a universal plan in the next year?
I think the budget is so tight right now that I wouldn't spend the money creating new programs or new entitlements, because the health insurance expanded at the federal level may or may not happen. And if you start creating new programs here, these are going to be new entitlements that could be very expensive down the pike. So let's just sort of sit tight for a little bit and see where Obama's going.
Then you're both in agreement on that. I agree. I think there's a ton of stuff going on at the national level. We can certainly wait. Thanks for the great update. See you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.